Hey everyone, I hope you're all well. One more sleep, and it's the big day. Corrective surgery on my tummy. Inspired by a lady called Ruth, who's in our group, A Big Girl's Journey to Lean, and she started to post her photos on Instagram probably about 6 months ago, and it was about the time that I was thinking that I might be left with loose skin as a result of my lean journey, and seeing her photos and her recovery just inspired me to take the plunge, and that's what I'm doing tomorrow. Um, so what can I tell you on this sort of tummy tuck eve, as the girls in the admin crew are calling it? Um, I'm feeling okay today. I slept reasonably well last night, which is good. Got a whole day of work to get through, and then I'll be ready for tomorrow. Now, as you know, I've been on a lean journey for 15 months now, following various plans, and I've decided to take the pressure off over the next few weeks while I'm recovering and not be trying to track macros or calories or anything like that. I'm simply going to have protein, fat, and a little carbohydrate, good carbohydrates, with each meal and two snacks. Keep it really lean and clean and not worry at all about what I'm taking in. My body is going to be burning lots of calories through the healing process, despite the fact that I can't move around very much. But I think the most important thing over the next few weeks is just to focus on healing and not be worrying about tracking. So, as long as I'm eating clean, that's the main thing. So, that's on the food side. On the training side, I can't train for at least 6 weeks. Now, because I'm having muscle repair, obviously you use your core for most things. So even simple things like sitting up or getting out of bed is going to be a struggle to start with, and I'm prepared for that. Um, so I'm just going to take it steady. I'm going to try and get into walking as soon as is possible, taking the advice from my surgeon, and use that as a method of fat burning during those 6 weeks. And then between weeks 6 and 12, I've slowly got to work up to where I am currently in terms of fitness. But actually, what I've learned from following others is that it can take up to 12 months to repair and to heal properly after muscle repair. So, I'm going to be swelling and goodness knows what for anything up to that amount of time. But I think what's positive is when I went for my pre-op a few weeks ago, I was handed a load of leaflets about the different surgeries that I'm having, and there's liposuction, muscle repair, tummy tuck, and all of them, of course, say that if you don't drink and you don't smoke and you exercise regularly and you eat well, then your recovery is going to be so much more straightforward. And I haven't smoked and I haven't drank and I've done lots of exercise and I've eaten clean for well over a year, so I'm hoping that that will stand me in good stead. The pre-op was also interesting because they did an MRSA test, where you had to like stick cotton buds up your nose and in your groin and all sorts of things to check that I haven't got MRSA. I had a full ECG and my heart rate is very low, the lady was saying, so I'm not sure whether that's a good or a bad thing. She also said she did my blood pressure. Now, what an NSV that was. I used to hate having my blood pressure taken because the cuff would never go over my big arms. And there have been many occasions where it's gone on my arm, and then as it's got to the point of contraction, it's actually popped the Velcro because my arms were so big. I used to just dread it. But the cuff went on really easily, and even more than that, the lady said to me, "Your arms are fabulous, they're so toned," and I was like, yes. She also said when she was measuring me for the garments that I need to wear afterwards for many a week, it's a compression garment and it helps with the subside the swelling. She said that I am so lucky that my body has sprung back the way that it has, given the types of people that she sees who've had extreme weight loss. So I do think I'm blessed around that when I look at the photographs, you know. I'm in a tummy tuck group at the moment, and there are many ladies who've gone through weight loss through different approaches and are in a much worse position than me in terms of loose skin. But they've gone on to have the procedure and look absolutely fantastic afterwards. So I know that I'm going to look fantastic afterwards as a result. And all of the hard work that I've put in and the effort is going to pay off. And I'm really excited and just can't wait. I've got an amazing husband behind me. My children are excited. The admin crew are excited. My friends are excited. I've got people coming to see me in hospital after the event. So bring it on, I say. Bring it on.